My name's Craig Mosley. I'm a veterinary anesthesiologist. I work at VCA Canada, 404 Veterinary Emergency and Referral Hospital as a staff veterinarian. I'm also the National Medical Director of Specialty Medicine for VCA Canada. I first became interested in cannabinoid medicine through a phone call from a colleague of mine, Dr. Sarah Silcox, who had contacted me to ask if I was interested in speaking on the use of cannabis in pets for a panel. And this was happening at a time where the legalization of cannabis was on the cusp of becoming legal in Canada for the recreational market. And I was quite frank with Sarah. I said, I actually don't know anything about cannabis and its use in pets. I've read about it as part of my residency, and when I was training as an anesthesiologist, I did learn a little bit about the endocannabinoid system, but I didn't really know that much about it. But that conversation led us to sort of start talking about the importance of veterinarians being part of this conversation and getting in front of the legalization, because we knew that our pet parents were likely to start using these products with or without support of veterinarians. And so Sarah actually took this idea of creating an organization, and 6 months later, the Canadian Association of Veterinary Cannabinoid Medicine was born. And since that time, the organization has been working to educate, advocate, and really collaborate with others in the industry on the responsible use of cannabis in veterinary medicine. I think it's really important for veterinarians to understand and become informed about the use of cannabinoids in veterinary medicine, because although these drugs have the potential to be therapeutics, there are also side effects associated with them. And I think we need to be aware of that and cognizant of that. And we also know that pet parents, when they're in situations where they don't have therapies that are treating their patients effectively, they will look elsewhere. And I feel very strongly that the veterinary professionals are the best people to help guide pet parents on the use of cannabinoids. And I think in the absence of that information and in the absence of having veterinarians with an understanding of how to use them properly, people will go elsewhere to get that information. And that for me concerns me, because they may not be getting as good quality information, they may not know where to source the products, they may not be using appropriate products. Animals certainly are more susceptible to intoxication from THC than humans. And so if you're using a human formulation, we may run into problems. So I think the responsibility really is within the veterinary community, that it's our responsibility to understand these products, because they are going to get used in our patient population. It's interesting. One of the questions I get asked frequently is, should we be concerned about cannabinoids being used concurrently with anesthesia? And right now, we don't probably have enough information to say 100% that it won't affect anesthesia. If I look at the literature on the human side, there doesn't seem to be a lot of effects associated with cannabis use in patients undergoing anesthesia, as long as they're not in a state of acute intoxication. So in other words, if they're having a high level of THC immediately prior to anesthesia, then this will impact anesthesia. But if it's a user who's using a CBD product, it's unlikely to impact anesthesia in any significant way. In veterinary medicine, one of the things I think we struggle with is we don't always even know which of our patients are on a cannabinoid product. And unfortunately, that's because a lot of owners, do not disclose that to us, or it may be that we haven't asked the right questions. So at this point, I'm not too concerned, as long as there's not overt signs of intoxication in the patient. But I do think it's something we need to be thinking about. And as new research comes out into the forefront of veterinary medicine, we'll be certainly looking at that. So I definitely keep it in the back of my mind. It should be part of the pre-anesthetic exam or question, to ask, is this patient on cannabis or any other products, which we routinely do. So I think it just should be part of the conversation. But as long as the animal's not showing acute intoxication evidence of that, I think I'd be pretty comfortable in anesthetizing them without changing the protocol significantly. Looking forward in terms of the use of cannabinoids in veterinary medicine, I probably have a few concerns about the future of where cannabinoid use is going to occur and how it's going to occur in veterinary medicine. I think one of my probably biggest fears is that these products may be used inappropriately in veterinary medicine. And again, because they are readily available as through the recreational market, I do worry that these products may end up being used inappropriately, which in some cases, if the animal's not harmed by this, some people may say, well, that's not really a big deal. But then the problem is that product is going to be said, well, it doesn't work. I tried it once and it didn't work. So I do think there needs to be some kind of structure around their use so that we can actually determine what works, which product, which patient, which disease. And that does require a little bit of sort of control around that, or at least controlled studies. And so for me, that's where I'm a little bit concerned. And I think that it's vitally important that veterinarians and veterinary paraprofessionals, veterinary technicians, and veterinary nurses stay engaged in this topic, because in the absence of their engagement and their involvement, owners will find other avenues to learn about these products, which may not be as reputable as the information they would get from a veterinary professional. Where I see the future going in terms of cannabinoid medicine, I'll be honest, I don't know where it's going to go, and I don't think any of us really know where it's going to go. But I think when we look at cannabinoids and what they are, I mean, they are a botanical, and they can be potentially a drug. And so I think in veterinary medicine, we're going to see them being used both as a therapeutic or as a drug, and these may be more purified formulations that provide specific benefits for specific diseases. But I think we'll also see cannabinoids being used as what we might consider nutraceuticals or supplements. And that's going to be a little different, and I'm not sure what these two areas are going to look like, but I do see there almost being two streams of cannabinoids in veterinary medicine. There'll be a nutraceutical stream, and there'll be more of a drug stream. And I think those two will sort of work in tandem with one another. But I do see the role for both of those into the future.